Pretty much my whole life, I've dealt with breast pain and tenderness and soreness and swelling. And I kind of always thought that it was normal up until the past couple of years. I started getting breast pain and tenderness to the point that like walking downstairs is really uncomfortable, or hugging somebody, or even wearing a loose fitting sports bra is pretty uncomfortable. I kind of just assumed that this was part of having a period and part of having a cycle and never really questioned it. But over the years, I have struggled with both endometriosis and PCOS, and the breast pain and tenderness has gotten worse. And I've started wondering, why do breasts get sore, tender, swelling in general throughout the month? And also, what is considered normal versus worth talking to a healthcare provider?
I want to start by acknowledging how difficult it is to have pain that limits your daily activities. I'm so sorry. It can also be really challenging to differentiate normal breast tenderness from abnormal breast pain. So here are some key things to know. Breast pain is quite common and will affect up to 70% of women at some point in their life. And cyclical breast pain is the most common type of breast pain that we see patients for. Cyclic breast pain typically peaks in the late luteal phase, which is the portion of the phase right before period bleeding starts. The leading theory is that when estrogen rises right before ovulation occurs, it promotes growth of breast tissue as well as fluid retention. Then, when progesterone starts to decrease later in the cycle, at the end of the luteal phase, it is unable to adequately offset the estrogen, leading to increased tissue sensitivity, tenderness, and inflammation. It is also important to know that this type of breast pain is more common in cycles that have normal ovulation, as opposed to cycles with ovulatory dysfunction. Breast tenderness is also a symptom of premenstrual syndrome, which affects about 1/4 of people with periods. It's important to seek medical evaluation when breast pain interferes with your daily activities or is non-cyclical, unilateral or focused in one area, and when the pain is progressive or worsening. It is also important to get evaluated promptly if the pain is associated with a palpable lump, overlying skin changes, or spontaneous nipple discharge. Just because breast pain is common doesn't mean it's always normal. If it doesn't feel right, always get it checked out.